What is your health care plan? Do you have one?
Well, let me ask you. When I look at government-run programs, are those government-run programs the most effective way to carry out any service? One of the things that, to me, that I think that we can do to reduce the cost of insurance is to try to work more towards tort reform.
I do have a health plan. We would cap the cost of what businesses can be charged for employee-sponsored health care. Right now, employer-sponsored health care wages have gone up 5%, outpacing wages that are 2.54% in growth. The average family of four pays $19,000 a year now for employer-sponsored health care. It is set to be $24,000 a year by 2020. So we all need to go get that second full-time job so that we can afford to have health insurance. Unless we recognize that health insurance has been a market failure. We are the last developed nation who is trying to hold out and thinking that the market is going to fix it, but it has not. They have had decades to fix it, and it has failed. So we have to take action for the safety and security of the citizens of the state, both for their health and for ensuring their wealth. Because if you go, the number one cause of bankruptcy in this country is medical bills, and you can go bankrupt with health insurance. So I would make Medicaid a public option through Peach Care. It is currently a public option for families that don't earn quite enough to qualify for Medicaid, but it's set up to take payments. It is set up for you to choose the policy that works for you. We would expand Medicaid in Georgia. That would immediately insure 500,000 Georgians. That would make our cost of care go down by not having doctors who don't get paid, from not having hospitals close. And my time is up, but I could go on forever.
Well, go on a little bit longer. And tell me how you would pay for all that.
Well, like we said, the healthcare industry gets a $300 million tax credit. But even if we couldn't roll back a single tax cut to corporations and the top 0.001%, it would cost a whopping $8.33 a month to fully fund everything in my platform. So if you save thousands on your health care, you save thousands on school, that is the best $8.33 you can pay a month to ensure that you have access to health care, your family stays safe, and you don't go broke.
Your argument is that there is an argument against expanding Medicaid.
The biggest thing is when I look at Medicare, okay, it's your money. My question is when we start looking at health care, where's personal responsibility come into that picture? To me, I get it. We have a program through Social Security that if you fall into a disability, and you're working here in the United States, there's a safety net for you in that. When I look at what's going on in health care, there are catastrophic risk programs that anybody can sign up for. When I start looking at what is the government's responsibility to provide insurance to you as an individual, I think that's an individual choice and an individual responsibility. For me, it's your money. You decide how you want to spend it. I don't like the government programs that don't need to be there. For me, when I look at government-paid health insurance for all, that's one of the things that we would look at and say no, because that's an issue that we're taking your money for somebody that's healthy and moving it to somebody that's not. To me, I just don't agree with the concept.
I choose to use one of mine.
You want to use your rebuttals for that? Yeah. Don Johnson,
I'll
go
take
ahead.
a lifeline here.
Phone a friend.
Yeah. The first thing is, you're already paying for Medicaid expansion. It's in your federal taxes, and it's going to other states. The incredible liberal states of Kentucky, Louisiana, and Arkansas have all expanded their Medicaid. Louisiana created 19,000 jobs in their state by expanding Medicaid. Because when these rural hospitals close, they're also the largest employer in those areas, and hundreds of people lose work. That's also why we have women dying at record numbers in Georgia, because they don't have access to even a hospital. If you live in South Georgia and have a stroke, too bad, you should have gone to Kentucky, because you're not going to get help here. But the other thing is $5,000 deductible catastrophic plans don't help most people. When you get cancer, you can't work. So where do you get the $5,000 to pay that copay? They don't have it. And it is in the Constitution that the role of government is to promote the common welfare. And if keeping you from dying isn't a good way to promote the common welfare, I don't know what is. But being sick is not